Live.
Hey you guys, it's Dr. Emer. Take a look. We have a patient here with a rare congenital birthmark called Nevus of Ota. Often it actually encompasses the eye and around the skin of the face. We're on treatment number 3 and she's already, I would say, about 20% reduction. We're using our first pass, doing our deep 1064 Q switch. This gets all the deep pigmentation and helps kind of break it apart. We're doing a special technique. In the old days, we used to call it R20. Now we use what's called a PFD patch, which is Perfluorodecalin. And what this does is it allows us to do multiple passes at once so that we can get more of this pigmentation faster. Because in the old days, this would take about 10 to 15 treatments, sometimes never, to even ever fully be able to get this to go away. But this patch allows us to, hold on, she has eye shields internally. Another one of these. She has eye shields internally. We pour some of this material on here, and this allows the gases that are happening under the skin from the tattoo removal to be absorbed much more quickly. And again, you can see what she looked like before. Much darker. Now we're at a lighter position, and we're protecting her eyes also by having the shields internally. So it's a process to actually do this treatment, but with the nerve blocks and the shields, we're well on our road to getting her an amazing improvement. Good. And we're going to do, again, like I said, a couple passes first, exactly, of our 1064, breaking apart our pigment. What are they saying there? Oh, look, some of the pigment's coming up.
Angel says, would this work for his upper cheeks? He's forever blushing.
Well, would not work for blushing, but it may work for pigment. So now we're going to switch. But if you want something for blushing, go to emeragecosmetics.com and sign up for a free virtual consultation. Aerify Kit is amazing from Emerage Skin, and we can give you some other options for skincare. We're now going to switch to the tried and true Ruby laser, you guys. The Ruby is a really unique. Can you see the last? Sorry. Hold on one second. The Ruby laser is a really unique laser because it goes slow, and it goes slow because, and I'm going to show you guys a couple passes, it's very superficial on the skin. And look, it has a really cool goggle. See? So we're going to do a pulse really quickly, a test pulse with the Ruby, and then I'm going to use the patch. Hold on.
Digita says they need your help. How can they get in contact with you?
So you guys see the frosting? You can go to emeragecosmetics.com, go to virtual consultation, or email appointments@jasonmrmd.com, you guys. So the Ruby laser is awesome because it's very superficial and it's the most absorbent to pigmentation. The negative to the Ruby laser, you guys know, it gets rid of surface pigment. So even though we're trying to get rid of her dark spot, she might get a little whitening, but the whitening is better than the darkening. And always the whitening will come back, or will improve over time.
They want to know what caused that dark.
This is genetics. Mom and dad having an egg and a sperm. It just happens, but she's still beautiful regardless. I feel, it's a unique thing. Everyone, it just depends. Some people are really bothered by it and some are not. We're going to do one first pass without the patch. And you guys see, we're going very superficial here. That's why you guys can see that it's not a frost like a normal peel. This is gases that are breaking apart as the pigment gets shocked by the heat. And those gases will dissipate in about roughly 20 to 30 minutes, but a lot faster if we use the patch.
They want to know, is this for brown pigment only? What about red pigment?
This is only brown. We can switch the laser to a red, to use for red, just FYI. So,
Remind everyone who might be tuning in what we've done to protect her eyes.
oh yeah, so we have metal shields inside, just so you guys can see, take a look. She's like Iron Man in there, because we're protecting her eyes. So now we're gonna, again, last one.
Is this similar to tattoo removal?
This is very similar to a type of tattoo removal, exactly. So we're gonna do our last pass. And this laser, you guys, is called the Tattoo Star. It's one of the best lasers on the market for tattoo removal by a company called the Slepion, one of my favorites, just so you guys know. Okay, so we're putting that on there. And we're gonna do our last kind of global pass. You guys can take a look at the extension. So we treated this area, we're treating this area, there's a little above and a little on the side. So now we get the patch on, we press down. Don't worry, she's being taken care of. We're not harming her.
Do you do PRP or exosomes afterward?
Not for this, I don't think you need it, because this is all internal. But if we were to do lasers, definitely would make a huge difference if we're doing like an ablative or a non-ablative laser, or if you had a wound. This needs growth factors. So my Emer Skin Refit Face was made for this, the peptides, Anti-Age MD, and we use silicone gel, and then you just need exfoliation. So in general, it's following our protocol. So again, we followed that little patch over there, making sure we didn't miss anything. And again, this is deep energy, you guys. And now, hold on. In our last pass, we're gonna go here. You doing okay over there, everyone? Okay. She's doing great. Eyes are covered. What would happen, you guys, if I hit her hair? Anyone know?
It would fry.
No.
No, not with this laser.
Now with this one, it takes black and turns it to white.
Oh.
Her hair would turn this like to a Disney princess that's gotten shocked by a witch.
Can you do my roots?
Yeah, we could do your roots with it. Perfect. We'll give you the platinum look.
How many days or months does it take for the skin to become normal? As we can see, it's turned a little dark.
1 to 2 weeks it takes for the darkening effect. And then, hold on a second. And then about 6 weeks for us to really see how much pigment's been reduced. And then we do another treatment.
Does it affect the hair on her eyebrows?
It does not unless I hit it.
So basically it's breaking it up and letting the collagen to reheat itself.
Yeah, it's breaking the particles into pieces of, taking a stone and it's making it to pebbles. So think of your pigment underneath as stone, and every time we hit it, it makes it to little pebbles, and then the little pebbles keep breaking apart into little smaller and smaller pieces that you can't see. All right, so we just finished. I'll show you guys really quickly the best part for her. Open up your eyes as much as you can, if you can. Perfect, hold on. Or close your eye, keep it closed, okay? We're gonna remove the shield. This protected her eye, and that is our treatment. So we treated each area, and she did wonderful. I'll let her relax a second. And that's it. That's treatment of laser combination with PFB patch for Nevus of Ota. All right, we did great.